So, hello friends, I'll give a snippet overview on this very large topic that I was given to deliberate in Coimbatore on 2nd November. So, the topic that was assigned was breakthrough research in onco-intensive care. So, as you can comprehend, so it's a very huge topic. It's a broad topic, which I'll do it in another video. So, in this particular snippet video, so I would like to encompass on the salient aspects that has happened over in last 5 years, which has changed the paradigm of onco-intensive care. So, it's a very good topic to ponder about. If you ask me, is there one drug that has made a difference in the survival in onco-intensive care? Or is there one specialty which has made a difference in onco-intensive care? Or is there some sort of a protocol that has made a difference? So the answer is a big no, because I have reviewed 92 research papers over last only 5 years, and you will be flabbergasted as to what has really influenced the change, what is possibly going to influence the change in onco-intensive care. You will be surprised to see what the technological advances which is making a difference. So that is something we will look into it in this snippet. So now the whole concept of onco-intensive care is futility to recoverable critical illness. So as the name itself enshrines, so they come very critically unwell. So trying to see from futility to how they can sort of catapult from the critical illness to some sort of a physiological semblance. So when you look into the whole research in the last 5 to 10 years, I would focus more on 5 years because that's where we would look at the research papers, what they've looked at. So there's improvement in the survival, mainly due to a few entities or few dimensions in onco-intensive care. The first one is immunotherapy, and more looking at targeted therapy and CAR T cell therapy. So these are the three sort of a dimensions which are making some impact with regards to outcome of the patients. So immunotherapy, precision therapy, that's the buzzword I'm sure all of my intensive care friends would relate to. So precision and targeted therapy and CAR T cell therapy. So in India, CAR T cell therapy has come in some sort of a form, but not as a mainstream therapy. So this is going to be the future of onco-intensive care or oncology. And intensivists, this talk is more pertaining to intensivists, not to oncologists. So the intensivists need to adopt to the patients who come to ICU as a result of toxicity of all the different drugs that they are given. It could be chemotherapeutic drugs, it could be targeted therapy, it could be immunotherapy. They come with complications to ICU. So intensivists are mandated to be aware of the drugs being used and the toxicities, because most onco drugs have their own list of toxicity that we need to be aware of. And most important, intensivists need to be aware of the rescue modalities in such sort of a clinical conundrum. And these rescue therapies have to be precision guided. So that is where, because unless you recognize what the problem is, one wouldn't be able to target it with precision. So these are some of the skill set intensivists need to be adept with. Okay, now coming to the juice of the matter. So what are the breakthroughs in onco-intensive care that has happened maybe over last 10 years? So one of the breakthrough is all the toxicities are well defined. So the major toxicities that we tend to encounter, especially in ICU, are the cytokine storm due to various drugs that are used. It could be immunotherapy or CAR T cell therapy, or sort of comes with the package of the cytokine storm syndrome. And there is a unique set of conditions like due to the drugs where we call it as checkpoint inhibitors or immunotherapy that are used. So this predominantly affects the lungs, and they come with checkpoint inhibitor pneumonitis. So that is a defined terminology. And very often you would see oncology patients invariably come to ICU in the late evening with respiratory distress and hemodynamic instability. So the two broad categories that they come with would be the cytokine release syndrome. They become hemodynamically unstable. They can have coagulopathy. They can have multi-organ dysfunction. or predominantly they come with short of breath. So there is a differential. So this is a separate video for that. You can go and watch. Checkpoint inhibitor pneumonitis due to a lot of immunotherapy agents are the common ones. And the therapeutic modalities for this would be obviously steroids and IL-6 receptor antagonists like tocilizumab. So there are certain advances happening in this area. So this is one dimension. The second dimension, which I already mentioned, is the CAR T therapy. So CAR T, just simplistically, friends, so this blue thing you see is the CAR T cell. So this is basically, as the name sounds, so chimeric antigen trigger receptor cells. CAR T cells is the chimeric. So as you see, these T cells are modified or re-engineered with this chimeric antigen. So all these spikes that you see is chimeric antigen, which go and attack these yellow ones, which are the cancer cells, and they are sort of precision oriented or programmed or re-engineered to attack these cancer cells. So this is the whole thing about CAR T cell therapy. And CAR T cell therapy has shown promise in situations where you would label someone as refractory malignancy to possible hope of having curative potential. And when you have a CAR T cell therapy or CAR T therapy in hospital, there should be ICU protocols to handle the complications of CAR T cell therapy. So, which is ICU preparedness with an ICU based management of cytokine storm that develops or cytokine release syndrome that we cause has to be there. And we should have all the gear to manage this because this can be life threatening. And there should be advanced neuro monitoring or multimodal neuro monitoring has to be there. So that is the second dimension. So the third dimension breakthrough is organomics. Organomics is more of phenotyping and creating a trajectory and predicting what sort of organ dysfunction one could anticipate in different oncological conditions and phenotyping the sepsis, which every intensivists are aware. We do talk about hyperinflammatory and hypoinflammatory or post-sepsis syndrome, post-sepsis immune paralysis. So this phenotyping of sepsis is becoming terribly important in oncology sector. And the fourth important thing where a lot of studies have happened in last 5 years is using AI algorithms with predictive analytics to portend the prognosis in oncological patients is becoming terribly, terribly important. And even having AI algorithms to detect the possibility of early deterioration prediction is really unfolding in a big way. So these are the key dimensions. And the fifth one, of course, is all the advances in the organ support. So there are a lot of case series, case reports on whether there is a positioning of ECMO in oncological malignancies, especially leukemia and in stem cell transplant. So these are the five dimensions where breakthrough research is happening. So very interesting. So, but in all these five dimensions, so you would think whether CAR T cell therapy is making an enormous difference in the outcome. Answer possibly maybe no. Whether having ICU preparedness for the cytokine release syndrome and identify checkpoint inhibitor pneumonitis, whether we are making a huge difference, I don't know. The answer may be no. But the lot of research in last 5 years is really revolving around three aspects. So AI, tele-ICU, and advanced imaging. So this is where I want to focus, friends. So I have reviewed 92 studies that have happened in last 5 years, and they have categorized into again five dimensions where outcomes are being influenced. So we'll just talk about it in the snippet overview. One is it having a protocolized approach to treating malignancy. So treatment protocol efficacy. There are 15 studies which has looked into this. As you can see the references. I've showed improved. See, there is a study from France over last 1 decade. That study really told us that there has been no change in the oncological ICU outcomes. Since over 10 years, there has been no improvement in the survival. But these 15 studies show there is improved in the patient survival and clinical outcome when AI algorithms are incorporated or AI decision trees embedded into the protocols for personalized therapy of oncology patients. And of course, the advances in organ support and tele-ICU. So this is where I want to focus, friends. So the future of ICU, which I'm ramming my head and which I'm dinning into everyone, is future of ICU. Every intensive care has to adopt AI algorithms in some way and tele-ICU. This is where even the leaderships are possibly not incorporating this into the hospital ecosystem. So it has to be personal AI algorithms involved or embedded or decision trees within your electronic systems, and tele-ICU or digital or telemedicine or whatever you call it has to be incorporated in the healthcare ecosystem. And early detection of oncological emergencies and timely interventions has shown to improve outcomes. So, which means the whole emphasis is on early recognition and timely without delay. Potential delays is what kills the patient. And of course, trying to identify the different phenotypes and risk factors to tailor the treatment protocols. So, these three entities encapsulate the sort of essence of improving the outcomes in onco-intensive care. So the summarily you can think having a protocolized treatment which is AI driven and using the digital or telemedicine or tele-ICU is a way to go in improving the outcomes. So this is the first one. The second one is technology integration. So again, in technology integration, they talk about integrating three technologies. What are the three technologies? AI, tele-ICU or telemedicine, and advanced imaging. These are the three technological advances. So there are 20 studies, friends. 20 studies which are integrating AI, telemedicine, and advanced imaging. These three are what is making a difference in oncological outcome, and those are the reference for you. So incorporating these three in the patient management process workflow process, patient management workflow process has shown to enhance the diagnosis and treatment precision, friends. So again, there is an emphasis on advanced imaging, AI algorithms, telemedicine, so that you pick up these cues very early on, establish the diagnosis early on in a precision way, and initiate treatment in a precision way. And it is shown that telemedicine should be utilized for continuous data analytics that has to happen, because now gone are the days where a clinician is meant to integrate the variables. So these data analytics have to happen minute to minute, second to second, as the data has been relayed from the telemedicine. And this has shown to help in decision making. And these are the reference studies from French articles. And this is very interesting. So there is something called digital twins. I'll do a snippet on what digital twins is. Summarily, digital twins is, so this is the real patient as you see. This is the digital, which is the digital imprint of all the variables that patient is going to have. So you create a model where all the input variables from the patient is put into it. Algorithm is created and trajectories are created with regards to prognosis and possible interventions to mitigate certain outcomes, friends. And along with large language models has shown to improve outcome. And there are studies, as you see, the reference studies are all in last 5 years, 2024 from German and from the US group have showed the digital twinning. So maybe the future of ICU will be, you will have a patient come into ICU. So you will open your electronic medical record and you will press the digital uh, template of this patient. So what the digital template is, it would have captured all the previous variables, all the comorbid conditions, all the lab variables, and it would have created algorithms which is showing you and navigating you towards certain interventions and certain nuances that you need to put in place to optimize the patient outcomes. So this is called digital twinning. So this may be a question in your DRNB. So be aware, digital twinning is here. So we may be talking about if a patient with say AML comes with acute distress, maybe I'll tell my team, so open up his digital twinning algorithms and let us see what has to be done. So this is the future. In maybe next 5 years, we should be talking about show me the digital print. So this is what is happening, friends. So that is the second dimension, technology. The third is diagnostic and monitoring accuracy. So this is the third dimension. There are 18 studies, friends, again showing AI algorithms with advanced imaging has shown to improve the sensitivity and specificity to identify patients who may end up with oncological emergency and even monitoring response to the treatment. And our AI with telemedicine also has shown to increase the accuracy of symptom detection and severity classification. So as you see, I'm time and again repeating 92 studies in last 5 years. Look at the reference of these studies, all in last 1 to 2 years. So they are focusing more on incorporating AI, telemedicine, advanced imaging. AI, telemedicine, advanced imaging. These are the only three buzzwords I can hear from 92 studies. And of course, we have challenges in identifying or bacteriological detection and sepsis detection. We still have challenges. So that is the third dimension. The fourth dimension is again the 92 articles show repeated emphasis on multidisciplinary team approach. There are 22 studies which are looking at multidisciplinary team approach to a problem with oncologists, intensivists, nursing teams, and ancillary healthcare teams to optimize clinical outcomes. And there is emphasis on tumor board has to collaborate with ICU. I think this I seldom see happening because tumor boards, at least in my hospital, has no intensivist. It has radiology and oncologists, and I don't know who else is there. But there is a studies reflecting on improving outcomes in these patients with even intensivists being part of the tumor board, and they have to be collaborative in nature. It is shown to improve treatment customization and decision making. And again, AI integration has placing this AI integration in the hospital management plan or the healthcare management plan has shown to improve the communication and improve the shared decision making. So that is about the fourth dimension. The fifth dimension is on ethical and implementation readiness. So there are 17 studies which have shown that ethical consideration has to be put for data privacy because now we are in the overzealous mode of capturing all the data into AI algorithms. So there may be an issue with data privacy, clinical acceptance, and there should be some regulatory governance for this data, especially with all these technological advances that are happening. There should be some governance and regulatory sort of a adherence also has been emphasized in the 17 studies. And the challenges that lie is algorithmic transparency and equitable sort of an access to the all these innovative means is something that is important, and measures have to be taken to mitigate the biases that exist in such algorithms also are the key challenges. And AI with telemedicine has largely been accepted by the patients and by the clinicians, but validation is important and governance is important. So these are the five dimensions, friends, that in these 92 studies that have come in last 5 years, the only focus is on all these, friends. So clinical entities alone cannot make a difference. It is technological adoption, telemedicine, and advances in the imaging. So advanced imaging, these are the ones we and putting these into the operational workflow is what is making a difference, friends. So if you look at the conclusions, overall synthesis, these are the five dimensions of breakthroughs. So obviously one needs to be aware of all the complications secondary to the cancer therapies. CAR T cells are here to stay, and we need to be adapt to having protocols in this. And phenotyping of the diseases is becoming important. Advanced organ support, obviously, you're all experts. ECMO has a role in certain malignancies, and the whole emphasis on AI and predictive analytics. So the breakthrough is treatment protocol efficacy. And as I said, 20 studies looking into integration of AI, telemedicine, and advanced imaging. The third one is 18 studies which has looked into incorporation of AI and imaging to improve sensitivity and multidisciplinary collaboration with oncologists and tumor board meetings to be collaborated with the ICU teams. And there are 17 studies which are looking into the ethical aspects of data privacy. So these are the breakthrough advances that are happening in onco-intensive care, friends. So it's a sort of a crisp overview on what has been happening as a breakthrough in last 5 years, friends. So very exciting journey. So AI, telemedicine, and advanced imaging are what are going to change the paradigm of oncological outcome, friends. So that's about it. So thank you, friends. Request you all to submit your work to Journal of Acute Care. Also, you can visit my website to read to this lecture. Thank you. Thank you, one and all. So it's a good quote, friends. I think the less you respond to negative people, the more peaceful your life becomes. So I think so. This is something we all face. So we need to be immune to all this. Thank you, friends.